Epilepsy is a chronic non-communicable disease of the brain that affects about 50 million people around the world. Like every other age-long health issues, it has its own myths and misconceptions. Today on the show, we are trying to look at how to dispel the myth and how to manage epilepsy. Good afternoon. You're watching Sound Health on Lagos Television. The conversation begins after COVID-19 updates. Please stay tuned.
WHO Director General Dr. Tedros Adhanom Ghebreyesus has announced the first 6 countries that will receive the technology needed to produce mRNA vaccines on the African continent: Egypt, Kenya, Nigeria, Senegal, South Africa and Tunisia all applied and have been selected as recipients of the Global mRNA Technology Transfer Hub. The initiative was established in 2021 to support manufacturers in low and middle income countries to produce their own vaccines, ensuring that they have all the necessary operating procedures and know-how to manufacture mRNA vaccines at scale and according to international standards. Primarily set up to address the COVID-19 emergency, the hub has the potential to expand manufacturing capacity for other products as well, putting countries in the driver's seat when it comes to the kinds of vaccines and other products they need to address their health priorities. Depending on the infrastructure, workforce and clinical research and regulatory capacity in place, WHO and partners will work with the beneficiary countries to develop a roadmap and put in place the necessary training and support so that they can start producing vaccines as soon as possible. The Nigeria Center for Disease Control reported 32 cases in the country. Kwara got 17 cases, while 7 cases were recorded in Lagos. 5 cases were reported in FCT, 2 in Rivers, and 1 in Kaduna. Over 254,000 cases have been confirmed, more than 230,000 recoveries, and over 3,142 deaths have been reported since the pandemic in Nigeria.
It's still Sound Health on Lagos Television. Joining us this afternoon is Neuroscientist Bankole. He is going to dispel some myths and misconceptions about epilepsy. He is also an advocate for the care of epilepsy. Good afternoon, Neuroscientist Bankole.
Yeah, good afternoon and thanks for having me. Thank you very much.
You're welcome. Epilepsy is a neurological disorder of the brain now. Why do people still label it as spiritual?
Okay, one thing people believe is if there is something that will take you down, for you to be falling down, jacking repeatedly without being able to control yourself. In the past, people believed that, it's only God that can actually do this. Okay, so they felt this kind of disease is quite not common. So for that reason, people find it to be kind of believe that it's actually something that has to be medical. So most of the time, when people talk about epilepsy, we tend think towards a spiritual, or sometimes people think it's actually an attack, and that's what most people actually always think. And as a result of that, the first approach to actually managing epilepsy, most people would rather go to traditional healers or religious leaders instead of actually visiting the medical facilities. So normally people should understand it's actually a neurological disorder, but because the fact that it involves people losing consciousness all of a sudden, sometimes happening even in the public place, and you being unable to control yourself, falling down irrespective of where you are, and doing a lot of things repeatedly that people don't seem to understand. So people just have to label it as something spiritual or otherwise.
All right, Neuroscientist Bankole, how do you tell it is epilepsy and not just any other seizure-related condition?
It's just like every other diseases or that has to do with the body, right? You carry out diagnostics. Like there are several other diseases that came up with almost the same symptoms with epilepsy. Like for example, a child could have a convulsion, possibly as a result of a febrile condition. Maybe the child is having fever, and as a result of that, he has seizure. The same seizure an adult could have it, or any other person could have it. So what we're looking at is if someone came up with a seizure, which is one of the symptoms of people living with epilepsy, you need to allow the person to go through neurodiagnostics, which involve the person going to the lab to carry out EEG. So EEG is called electroencephalography, which involves studying the brain waves of the person. So whatever comes out as a result of that will determine maybe we can now say this person may continue with anti-epileptic drugs, or possibly this person is actually not epileptic. Okay, and there are other things that are also that we can also use to actually determine whether someone is epileptic or not. One of the reasons is if someone had a seizure and he had it repeatedly for more than twice, more than once, he had it first, second, and possibly third time without any background additional symptoms. For example, he's not having disease, he's not having any febrile condition, he just had a seizure, and this continued to repeat itself maybe over a period of time. Then we will be kind of suspecting that this person may likely be suffering from seizure or epilepsy, so to say.
Okay, aside from accidental fall, are there other causes of epilepsy? Many people have said maybe a child hit his or her head on the floor when the person was much more younger. Are there causes? Could it be hereditary now?
Okay, now I need to say this. If we are talking about epilepsy, in 75% of cases, I would say we can't say we really know the real causes of epilepsy. But there are instances, possibly traumatic, that is road traffic accident or through childbirth, and there's actually an injury to the brain of the child, maybe during childbirth, or you may even say maybe as a result of disease or something like that, or sometimes post strokes. Some may have seizure as a result of the effect of stroke on the person's cerebrovascular what's it called, vessels. Then also there could be other reasons, but the main thing is in most cases we don't get to know the real cause why the person is actually having the seizure. But one thing we should be glad about is that the seizure can actually be controlled with medication, depending on the kind of seizure the person is having. In terms of hereditary, there are, but these are less than 1%, if I may say. And mostly hereditary kind of seizure or epilepsy are the types that linger on for quite a while, that you have to still continue to use medication. Some of them seems not to be controlled. Yeah.
Okay, you mentioned earlier in your response that one could also epilepsy could also occur as a result of maybe one health condition like stroke. Are there other health conditions that may also lead to epilepsy?
Just like I said, someone had an accident. It could be traumatic, any kind of accident. Anything that happens to you that you possibly hit your head, possibly on the floor, on possibly a hard surface, or any form of accident could actually affect the normal functions of the neurons. So as a result of this, this could lead to seizure or eventually epilepsy in people. So even sometimes there are anything that could lead to the metabolic imbalances in the body. Okay, because when we're talking about neurons, it needs a certain certain environment to work perfectly as well as effectively. So when all those environments are not attained, okay, you could be expecting a seizure in the possibly in anybody. So I always say anybody that has a brain can have seizure. So it depends on what really bring about your own the person's kind of seizure. Okay, some are actually controllable. Some you only need to treat the symptoms, and the person will not have the seizure again. But in the people with epilepsy, they will need anti-epileptic drugs to actually stop or control the seizure.
All right, is there a cure for the condition now?
You said,
is there a cure for epileptic condition?
I will say we call it control. We don't say cure. Okay, so if you are epileptic and you are confirmed with a EEG that there are some abnormal waves in your brain, so with that the doctor can easily determine the kind of medications to possibly use for you, as well as the dosage, depending on the kind of damage that is going on in your brain. And as a result of that, the person may need to use the medication for like possibly 2-3 years, depending whether you're in pediatrics or an adult. Then afterwards, it starts to review. Okay, if after the person starts using the medication, you didn't have the seizure again for a very long time, maybe for like 3 years, they can start to like possibly reduce the medication for the length of like 6 months before stopping it finally. And we call that control. And that is if the person did not have it again afterwards. But we've had situations whereby people's medications are controlled. That is after their seizure stop for quite a while, and sometimes maybe due to one activity or the other, one disease or the other, they like have a kind of a breakthrough. They have another seizure after a very long time. So that's why we say the medication will control it. So it not depends on the situation of things. But most people we've had here, possibly in youth, in fact, the highest percentage of them have their seizure control as a result of medications.
Okay, Neuroscientist Bankole, how do we manage these conditions? You just said that it has no cure. Are there lifestyle, are there particular issues or things that trigger seizures? How do you stay away from this to avoid seizures?
Okay, now I need to say this. There is a way we manage and there is a way we help. Okay? It's a different thing to manage the seizure and it's another thing to help when people have the seizure. Okay? We can't stop seizure when it starts, right? We can only help those who have seizure. But when it comes to epilepsy, we can manage them. How do we manage them? We always advise them to possibly use their medication as prescribed by their physician. Okay? And when they use it, we tell them not to possibly drink alcohol, not to smoke cigarette, because most of these things actually hinder the effect of some of these medications. So we stop them from all these things. And but when it comes to helping them when they have seizure, I need to kind of clarify here. There is a difference between seizure and epilepsy. Okay, epilepsy is a condition whereby someone is having recurrent seizure. Okay, but when we are talking about seizure, it is what every one of us see, what we call the attack. So when someone is having the attack, which is the seizure proper, the way you help the person is you don't hold them too tight. Okay, you don't hold them tight at all. Then you don't put anything in their mouth. Neither do you need to put anything on their faces or whatsoever. The best thing you can do as at that particular time is to clear the surface of anything that will injure them, anything, any sharp object or any very hard thing on the surface that they hit their heads on. You may clear the surface of those things, and apart from that, if they have a tie or something tightening their neck, you may need to loosen it for them in order not for them to possibly suffocate. Another thing you could do for them is to make sure if you have a shirt on or you have something like a pillow, you can put under their head while the seizure is on, so that if they have to even hit their heads on the floor, it has to be on the soft surface and not on the hard one. Okay, then another thing we could possibly do again is after the seizure, okay, when they are having post-seizure relaxation, we may put them in a recovery position. Like recovery position is quite easy. You do it putting them on one side, tilt their face a bit up in order for them not to choke. Okay, one thing I always advise people not to do is you don't pour water on their head whenever they're having the seizure. Sometimes we kill them and we claim it was the seizure that killed people. because when you pour water on their head, the water may enter into their mouth, through their the wrong place, instead of going through the gastrointestinal tract, go through the respiratory tract, and before you know it, the person actually choked to death. Okay, and as a result of that, most people claim that okay, we wanted to help, but the seizure killed him. Okay, but our act of ignorance actually killed the patient. So these are the areas we can easily help them whenever they're having the seizure. Okay.
Okay, so what next can the person do after he or she comes out of the seizure, the session? Now, can the person just see a medical doctor or just go home after the session and take his or her medication?
After the seizure, precisely, there is what we call post-seizure effect. Some of them will sleep off, tired. Some of them will be in confusion. Some of them will wonder about. So the thing is, you stay with them till they recover fully. And when they recover fully, you advise them to see the nearest, to go to the nearest medical facilities to possibly see a neurologist. Okay, a neurologist they are physicians that are trained specially to a kind of manage diseases that have to do with the brain. Okay, with epilepsy inclusive. So when they see them, there are some of them that are epileptologists who are specialists in managing epilepsy. So when you see these people, they know what to do, they know how to manage you, and they will make sure you get better. And which is what we have always been telling people, that these are the right people for you to see. Whenever you see any of your people, or you see anybody having seizure, or they are living with epilepsy as a condition.
All right, your call to action and advice to persons living with this condition as we wrap up.
Okay, yeah. First, if you're living with the condition, the best thing you can do for yourself is to speak out. And the problem I have with most people living with epilepsy is possibly because of the discrimination against them, and the fact that the general environment are actually ignorant about the condition. So that discrimination makes most of them to possibly hide. They don't come out. So as a result of that, my call to action is that whenever you know you are actually living with epilepsy, the best thing you can do to help yourself and to help others, it will be fine for people's life to be lost through you, because we have drivers in garage, in all those places. You have even people riding Okada. Some of them are living with epilepsy, but they won't tell you. Because they are shy and because they are afraid of discrimination. Okay, but if we don't take care of these people and we don't give them the confidence to come out, and they don't come out too as well, each and every one of us too are putting our life in danger. Who knows, the next Okada rider I'm meeting on the road may likely be living with epilepsy. What of if he's carrying me to somewhere and all of a sudden he developed the attack, which is seizure? You will not only be the one that we get injured. Myself following him, we actually get injured as well. The same thing applies to our drivers, people driving our cars. How many of them do you know that are living with epilepsy? So the best thing is for every one of us to stop discriminating against them, to create an environment for them to come out and speak, to come out and say they live with it and get treated. So if you're living with epilepsy, the best thing you can do is please come out, see these physicians that can take care of you, so that in future you won't put your life as well as that of your family in danger. Okay, if I may give an example, there was a woman who was having a child. Okay, she was having a child at her back, and she was going on the road. She actually had seizure, and when she had it, what happened was that she fell down. The head of the child actually hit the sharp part of the gutter on the road. And what happened? The child died immediately. And what Nigerian did to the woman was to give her a beating of her life, just because they felt she killed her child. But they didn't realize that she was actually not in her own senses too as well. So for us to prevent all these kind of occurrences, the best thing is when you know you're living with this condition, please go to the nearest health facilities, see the physicians that will take care of you, and get yourself treated, get your seizure control. Yeah, thank you.
All right, seek medical help early enough if you are experiencing epileptic condition. Neuroscientist Bankole, thank you so much for your thoughts on how to manage epilepsy. We really appreciate you.
Oh, you're welcome. Thanks for having me once again.
All right, Sound Health continues with Trending Health Report. Please stay tuned. It is still Sound Health on Lagos Television. This is where we say thank you on today's episode. Ensure you get help early enough for any conditions. You also need to stay safe. COVID-19 is still real. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at TLTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.